February is American Heart Month, and while we mostly think about heart disease and prevention in adults, it's also important to know the signs of heart defects and heart disease in kids so we can keep their hearts healthy too.
Here to tell us more is Sanford pediatric cardiologist Dr. Carlos Miranda. Welcome.
Hello, welcome. Thank you for having me.
You bet. Thank you so much. This is a very important topic. So we don't hear this in regards to children. So I'm surprised. Kids can really have heart disease.
Yeah, they can. Basically, about 1% of all kids can have some level of a heart defect. We call it congenital heart disease or congenital heart defect. Basically, it's made up of maybe a defect within the tissue of the heart, a defect within the valves of the heart, and/or abnormalities within the arteries and/or veins of the heart as well. But it's not the same as what one would consider a heart disease in adults. This is not acquired. This is more something that somebody's born with.
So, if you're a brand new parent, or maybe you're pregnant right now and you're thinking, oh my goodness, when my baby's born, how will I know if they have a heart defect? What can you tell parents?
In the worst of cases, a baby is born with either a severe heart defect that causes them to be blue or causes them to have low blood pressure, and it will lead them to be transferred to an institution that can take care of this defect. In the more what we call subclinical, maybe they don't have that many symptoms after birth. A lot of times you can pick up a heart defect from a murmur, or you can pick up a heart defect from a lack of growth, a lack of or difficulty feeding, or difficulty breathing that's progressive over time. And usually a murmur within the first year or first 2 years of life doesn't really mean that you have a defect within the heart, but it should be evaluated by your primary care provider. And if they feel it's significant enough to see a cardiologist, then we evaluate it as well. And at that point, before coming to see the cardiologist, doesn't mean you have a defect, but it's something that once we listen to the child, we'll be able to tell you whether or not further testing should be done, such as an echocardiogram or an ultrasound of the heart that takes images of the heart.
Can we talk as well about heart disease risk factors, and what are they and how can we reduce them in kids? Because we were talking about birth defects or heart defects, but is there, risk factors as well as they grow up?
Absolutely. So when we talk about heart disease, and when we talk about it in adults, we're talking about heart attacks or stroke, basically. And the easiest ones are having a good diet, having good exercise. Also included in that, obviously, if you have risk factors like diabetes, hypertension, to mitigate those risk factors as well. But I think one of the more important ones that we're becoming more aware of is a genetic predisposition. So families that have family members within them that have had a bad outcome, such as heart attack or stroke, males prior to the age of 55, females prior to the age of 65. And those particular families, we should look closer into their kids as it pertains to their kids' cholesterol levels, because we could do the biggest change in their child's life by mitigating those cholesterol levels early on in life.
Well, Dr. Miranda, thank you so much for your time. It's interesting to visit a little bit. We focus so much on adults and heart disease, but heart defects in our babies and, growing up with healthy hearts for our children is an important topic as well. So thank you so much for your time.
Absolutely. My pleasure.
Stay with us. Coming up next here in North Dakota Today, we're going to check in with Brian Sherrod to see what we can hear about on our news at noon. Also, get your daily motivation.